At 10 to 8, that makes it time for a bit of hope and for some good news perhaps, maybe even a solution to what for a decade now has been talked of as perhaps the most significant and underestimated threat to global health. No, not a pandemic, rather antimicrobial resistance. What is it and what can we do about it? One group who think they may have a practicable plan are the Association of the British Pharmaceutical Industry, the ABPI, and they join us now in the form of Executive Director Dr. Amit Agrawal. Dr. Agrawal, good to see you. Good morning.
Thank you. Thanks for having me.
Just for those who weren't listening to us an hour ago, can we start with the basics? What is antimicrobial resistance?
Yeah, absolutely. So antimicrobials, they include antibiotics, antivirals, antifungals. But when we talk about antimicrobial resistance, or AMR, in the main, we're talking about antibiotics. And we're talking about the process where some antibiotics have, in some instances, become ineffective against certain bacteria. And that leads to persistent infection or untreatable infection in patients. So, you will have heard the term, the rise of superbugs. And that's essentially what we're talking about when we talk about AMR.
And just to be clear, the WHO says this is a massive global health risk. It's one of their top risks, and it's one that's a very big problem in some parts of the world right now.
Absolutely. I mean, the current estimates are that, globally, worldwide, there are 1.2 million deaths every year directly attributable to AMR. And possibly even 5 million deaths that are in some way associated with AMR. And as you say, the WHO has it on their list of one of the top 10 global public health threats that are facing humanity.
Factory farming, I only learnt this in reading our brief for this interview. Factory farming actually is the number one cause or use of antibiotics in the world. So some people say you should farm differently. There's a lot of people who say that we as humans are using too many antibiotics, and that's part of the problem. And the third thing is we need to develop effective new drugs somehow at something close to the rate at which these microbes adapt. So let's talk about some of those solutions. What is unique about how we control antibiotics in the UK?
Well, in the UK, we obviously antibiotics are only available on prescription in the UK, and that's certainly true of most kind of Western nations. It is the case, however, that in some countries antibiotics are freely available to purchase from pharmacy, and a combination of widespread use of antibiotics across the world has been one of the major factors really in leading to the rise of antimicrobial resistance. So in the UK, although we have good measures, but in many countries that's not the case.
And just before we come to this interesting pilot scheme, this solution, has it been forbiddingly expensive to develop new drugs, and have we got the right incentives in place?
Yeah, incredibly so. I think the history of antibiotic development is littered with failure. To give you an example, there hasn't been a new overall class of antibiotic discovered since the 1980s. Which is extraordinary, really.
Why does that happen?
Developing antibiotics is notoriously scientifically difficult, and it's very, very expensive. And there are many companies that have, small companies, medium companies that have come along and been bankrupted by the effort, and it's really led to a sort of disincentive for bigger companies to invest. Part of the issue is also that the usual model whereby for antibiotics, you want to discourage use, good antibiotic stewardship. You want to discourage use and reserve those antibiotics to prevent resistance. You want to reserve those and use as little as possible. That obviously doesn't lend itself to a financially sustainable model for companies investing.
But there is a plan. There is this pilot scheme. It's been given a sort of catchy title so that people like me say this on air. It's been called the Netflix model. Just explain what the plan is, this kind of subscription service to help promote new drugs to help treat AMR.
Yeah, so this is somewhere where the UK is really trailblazing and really leading on this front, in part to try and fix that broken model where the incentives are not there for developing antibiotics because you're trying to discourage use. What this model is essentially is a subscription model whereby health systems, in our case the NHS, will pay a flat fee for the use of an antibiotic. That's regardless of whether 10,000 or 100,000 patients use that antibiotic. And then what you do is then you essentially decouple the volume of antibiotics used from the financial return on that investment. And that's something where the UK has conducted a pilot, which started in July last year, with the aim of moving to a permanent model sometime this year. And that's genuinely a world first, and other countries, US, Canada, Japan, are looking closely at what we're doing and looking at whether to introduce a similar model of their own. But this is genuinely a UK world first that's been done in conjunction with industry, the NHS, NICE and the Department of Health. So you've got that really important pull incentive. But that pull incentive only works if other countries also join and develop their own pull incentive.
And is there any evidence about how that pilot scheme's going at all? Is it too early to say?
So far, the feedback has been pretty good. A few kinks to iron out, of course, and there will be a consultation on that process.
I was reading this paper in the Lancet published in January, which has, in fairness, has quite a lot of jargon, but it has a lot of criticism of this pilot. It says, despite the UK's official aim to incentivise investment in AMR research, the current subscription funding does not convincingly reward innovative research into new chemical space, and instead the annual price of a £10 million per drug will support the antibiotic portfolios of 2 large pharmaceutical companies. In other words, this is, long story short, the game is rigged and Big Pharma's going to win. That's a criticism.
Well, apart from the UK model that we've just discussed, in part to help smaller companies, startups to bring their own antibiotics to market, at the global level, you have something called the AMR Action Fund. And what that essentially is, that's pharma companies, big pharma, medium and small, putting $1 billion into a pot, working with the World Health Organization, working with the Wellcome Trust. And that 1 billion pot, which was started in 2020, aims to bring 2 to 4 antibiotics to market by 2030. And that fund already has provided its first investment last year, another investment in January this year, to smaller companies who are trying to bring an antibiotic to market. So I think actually on that front, there's a lot of work being done by all sizes of pharmaceutical companies to really try and address this issue.
It's a fascinating area with big implications. Dr. Amit Agarwal from the Association of the British Pharmaceutical Industry, thank you very much for coming in.
Thank you.